I think for so long, we've looked at women's health between reproductive years. And it's saying, okay, when women are having children, that's when we're going to pay attention, or that's when we're going to really focus on them. And maternal care is very important. But the reality is women have, challenges with their health or needs before they're in their years of childbearing. And then also, what about after? Once we have our kids, we don't disappear from the earth. There's a whole other life cycle around perimenopause, then menopause, and then postmenopause. So, and even longevity and health span, which is kind of the biggest trend that, I see for the future. So there's just so much more to this. And then we look at funding, we look at women's funding globally. Women only receive about 2 to 3% of VC funding. Okay, well, now you add a layer of that being women's health, where the majority of the funding in women's health goes to oncology, like breast cancer. So we're not actually even seeing a lot of the studies on PCOS or endometriosis or, the funding of research, but moreover, the funding of startups.
Hello and welcome to the Biohacker Podcast. I'm Azra Alagic, your host and founder of Biohacker. I'm an integrative nutrition health coach specializing in longevity for women, a health and wellness journalist, writer, corporate consultant, and a biohacking advocate. Biohacker is a space where we can explore ways to optimize our health to live well longer. Whether it's through improving our nutrition, exercising, cryotherapy, supplementation, technology, and more, I'll be bringing you information and interviews with the best longevity experts to help you understand what you can do to optimize your health, prevent disease, and slow down or even reverse the symptoms of aging by taking control of your unique bio-individuality. Want to know more? Let's dive in. Lindsay, welcome to the pod. You built FemTech Association Asia into the region's first and largest specialist FemTech network. What gap were you seeing that everyone else was missing?
First of all, thank you so much for having me. I'm really excited to be here and to meet you and spend some time online with you. And thank you for everything you're doing to kind of raise the profile of women's health, including our chat today, which is really exciting. I'd love to say I saw this gap and dove in and was like, oh, I'm going to solve this problem and had this entrepreneurial, spirit flowing through me. But actually, I had moved over from London at the time, where I'd lived for about 14 years. And knew I wanted to move into the tech space, didn't know what. So I think I had my eye out for just what people were talking about. I ended up meeting a wonderful woman at an event where I was moderating a panel, and she started talking about FemTech. And I said, oh, women in tech, I love that. And she was like, no, female technology as in women's health and technology. So I started looking into it because I thought it sounded interesting. And I thought, oh, well, I'll join, the network, or I'll, help a company as, even an intern, I'll support however I can, maybe do some funding and invest. Turns out there really wasn't a connected ecosystem. So rather than me being this, big visionary leader, perhaps it was more about just looking for something that I found interesting, and then saw there wasn't really an outlet outside of kind of a fragmented market of really talented entrepreneurs. They all kind of knew of each other, but weren't working together. Or a few investors, but there wasn't really a femtech industry body that was kind of promoting and amplifying the industry and the startups. So someone said to me when I was meeting with them, one of the entrepreneurs, are you going to start an industry association? And I was like, yes, I guess I am. So it kind of came more falling into it than this massive, lightning bolt. But, it's been really great. And I've learned a ton.
Yeah, and was there a particular gap there? It sounds like that there was, because there wasn't this sort of collective there in Asia for women in femtech.
Yeah, I think the term femtech even was really only, coined in about 2015, 2016 by Ida Tin from Denmark, and the founder of Clue, the menstrual tracking app. So I think knowing that was only that recently, 10 years ago, right? So even the term wasn't really widely used. So I think part of the gap was just a lack of knowledge that the industry even existed. Of course, we all know health tech and healthcare and digital health existed, but not necessarily that focused specifically on women. So I think as times have changed, we've seen greater consumer awareness, and then starting to ask their doctors, well, where's the solution for this? Or I have this problem and I need help. Where do I go? So I think the consumer demand is really the biggest gap that we've seen, that they just haven't been able to find the solutions that they need. And in turn, I think really savvy founders have come in and said, there's consumer demand and no one's fulfilling it. So why don't I take that role? Thirdly, I think again that ecosystem, it's just taking a bit longer to build the ecosystem than we see in other industries. And that, we can chalk up to baseline bias, but there's some other parts as well that we'll see, which differentiates, Asia from Western Europe, from the US, etc.
Are you seeing market differences between those regions in terms of the take-up of femtech?
Yeah, I do. I think when we're talking about like consumer use, what we see here in Southeast Asia is that about 60% of women in Southeast Asia, when talking about Southeast Asia, I'm talking about Indonesia, Malaysia, Singapore, Philippines, Thailand, Vietnam. About 60% of women are users of femtech. And typically in that space, we're seeing more of the CPG based, menstrual pads or innovative sustainable, biodegradable care. But at the same time, since we started FemTech Association Asia just 5 short years ago, we've already seen a complete change in low tech being less represented and really some of the higher tech coming into play, more AI driven solutions, more apps on the market. When I started this, there were only 6 apps in the market. Now almost every company has an app. So it's such a difference that we've seen. And I just think progressive funding, we've seen funding progress more in the US and Western Europe than we have in Asia. But I think that that will change, especially as we see more government involvement.
That surprises me because I would think that in Asia it would be more available, the funding would be more available over there. I mean, they're so innovative in Asia.
I think there's not a lack of funding. I think it's specifically the knowledge. I think
Right.
there's a real knowledge gap here. And I think, secondly, when we look at femtech, we're talking about women and women's health. I think when we walk into, rooms and typically, well, what we see here in Southeast Asia is 75% of decision makers at VCs are male, are men. So if we only have that 25% voice, or if the investment thesis is already secured, how do we bring women's health into that discussion? How do we talk about things that could be seen as taboo? We know that 52% of consumers in Southeast Asia, women in particular, do feel that there's a cultural stigma associated with openly discussing women's health care or women's health needs. And, the main fear or the main concern is fear of judgment or shame. So part of it is even just cultural taboo that we're battling through. So we've got, a lack of representation, in at the funder level, but then we even have a lack of consumer engagement. And again, I think that's going to all pivot once we see more government leading, especially with so much nationalized healthcare.
How do you envisage navigating those cultural differences and those taboo subjects, particularly in countries where it's more of a patriarchal system and they're maybe not as forward thinking as perhaps some of the Western cultures are?
Well, first of all, as our role as FemTech Association Asia, we have kind of 4 key pillars. So our 4 key pillars are thought leadership, amplification, community building, and programming. So programming, running events, virtual opportunities to partner with other organizations for events, really getting the word out there. So, the first part is how are we actually getting to market and communicating and amplifying the industry? Second thing is I talk about community building. At the end of the day, we talk about trust as a key component and a core component about what most women think about with their healthcare. We want to trust the provider or trust the solution or trust the company. And so I think a lot of that will come from building a network that is across clinical providers, startups, big pharma, hospitals, clinicians, corporates, all of these players together to create kind of a trusted, vetted ecosystem. We do a lot of work in amplification, working with the media to bring these solutions and the founder stories to light. And then, the biggest thing I'd say is really looking at the facts. And what do I mean by that? I mean thought leadership, our research. So a lot of what we're doing is putting research at the forefront. So our goal is certainly not to represent the consumer, as you can hear from my voice. I'm a British U.S. citizen, so it's not up to me to represent what Asia consumers would like. But what we're actually seeing is the startups being the foundation of change and the foundation of amplification and building trust with the ecosystem to kind of make sure that we are making strides with consumer education and also connectivity in the space. So that's, I think, where it starts really is kind of at that ground level of connectivity across our ecosystem.
Mm. I'm wondering whether you think that the new femtech that's coming through in itself is helping to bridge that gap in terms of getting women's health more out in the media, more, lifting the lid off it, so to speak, so that more people are talking about it.
I think you're absolutely right. And I also think there's a bit of a generational difference here that younger generations are more comfortable. I think things that we can be grateful to social media for, among the many things I'm not, but something I think we can be grateful for is the share of knowledge. Now, that's not to say we should follow our influencers. We should always follow our doctors for medical advice, as we all know, and our providers, medical providers, licensed medical providers. But the fact that there is even a curiosity that people know that they're not the only ones going through this, whether it's PCOS or endometriosis or menopause, even. We are not alone on our healthcare journeys. The odds are someone else has been through it. So even finding community to kind of be a part of, I think that that's important.
Agree. Why do you think women's health historically has been so underbuilt from an innovation or investment perspective? Because it seems to be the case, even from a research perspective, it's certainly been the case.
Yeah, and you touched on it right there. I mean, women's health has historically been under-researched, underserved, and underfunded. We know in research there's a lot more coming out, but it still remains quite fragmented, even if the research is there. I have some fun facts for you. Before 1993, most testing done in clinical trials and diagnostic and device development was conducted on men. So women weren't even a part of the trials. So we don't have a history of being involved. And then secondly, a kind of a fun fact, not fun fact, is that not until 2016 were female mice mandated to be in research by the NIH. So even looking at like how we're doing our testing, women and even females on an animal level, are not being included. We see that gap. Underserved, I think for so long we've looked at women's health between, reproductive years. And it's saying, okay, when women are having children, that's when we're going to pay attention, or that's when we're going to really focus on them. And maternal care is very important. But the reality is women have, challenges with their health or needs before they're in their years of childbearing. And then also, what about after? Once we have our kids, we don't disappear from the earth. There's a whole other life cycle around perimenopause, then menopause, and then postmenopause. So, there's so, and even longevity and health span, which is kind of the biggest trend that, I see for the future. So there's just so much more to this. And then we look at funding, we look at women's funding globally. VCs, women only receive about 2 to 3% of VC funding. Okay, well, now you add a layer of that being women's health, where the majority of the funding in women's health goes to oncology, like breast cancer. So we're not actually even seeing a lot of the studies on PCOS or endometriosis or, the funding of research, but moreover, the funding of startups. If we're talking to a room of mostly men and we're discussing, PCOS, and they say, well, my wife doesn't have that problem, it's maybe not as relatable, but we're also looking at a sample set of one. So how do we overcome that? And of course, that's through, diversifying our investors.
It seems to me like such a lost opportunity for these investors. When you think about population-wise, hello, there are a lot of women out there, right? Guys are missing the boat on this one, do you think?
Yeah, and I think part of that, I'd love to say it's all the investors and, they should be more engaged and more involved. But actually, we have another issue too on the other side, which is our responsibility as industry leaders, which is to make sure that we really are positioning the industry solidly as a commercial industry, not an impact only industry. So I think when I hear a lot of founders pitching, they start with their personal story. I had this issue getting pregnant. And so I started a fertility company, and they talk through their personal story, which is very powerful from a founder perspective. But we need to make sure we're immediately talking about the market need and the revenue that can be generated from that. So I think it's really important that we don't lose women's health in impact and charitable giving and donation and a feeling of, I'm giving so much. It should be, this is a commercial opportunity. And whilst right now, I don't think we're seeing the returns in the 3 to 4 years that a VC would love to see, I do think in the 7-year span, the 5 to 7-year span, we will see that turnaround. So it's more about the patience and being first to market and being brave, I think, in taking the risk in funding to know that there really is just so much white space here in Asia and that entrepreneurs coming in can own a lot very quickly. So I see this as kind of an initial slow burn, but once it takes off, I think it'll grow immensely.
Mm. When you look across Asia, where are the biggest opportunities in femtech right now, and do you think are the biggest blind spots?
That's it's a really good question. I think when it comes to women's health, Singapore is really still the leader. We have about 40% plus of the companies in Southeast Asia in particular, but even broader, if you look, Singapore and Japan really are the leaders as far as, and China kind of in the space as well. Those three markets really are the largest as far as the number and the volume of startups we're seeing. So when we talk about markets, I'd really look at those three. Having said that, Singapore in particular is a very small market, but what makes it powerful is the tech and the innovation and the security of doing business here and the safety of doing business here and the trustworthiness of the Singapore brand. So I think when we talk about delivery and expansion, we're going to see a lot of it starting in Singapore, but quickly going over the border to Malaysia. We're seeing a lot of growth in Indonesia. I think when it comes to categories, we look at healthy aging and we look at longevity as the next trend, and frankly, a little bit of a blind spot. Again, I still think we kind of look at fertility, and especially with a lot of countries in Asia suffering from low birth rates. It's kind of something that's top of mind for a lot of governments. So fertility is an easy thing to pull in, but I think we actually need to also look at longevity. And I think this is a really interesting dynamic that we've seen. I read an article recently about this with Singapore is doing so much to support aging, healthy aging. We know that our workforce is going to be working longer. So a lot of it is about saying, let's not take people out of the workforce, let's keep them in longer and stronger. And so part of it is even just looking at, economic well-being and tying health to economic well-being, which again comes back to my point earlier around femtech being commercial. Women's well-being means stronger societies, means greater work. So sorry, I'm talking about a lot of things, but your question is, where are the big opportunities and blind spots? I think longevity as far as a category. I think looking at cross-border expansion out of Singapore, also China moving into other markets and Japan moving into other markets, especially in Asia. And then I think when we look at the customer, looking at B2B customers. So actually saying, okay, B2C is really strong, but if we want to scale, we really need that corporate entry point. So things like employee benefits through insurers, these types of platforms that can reach more people faster.
It was interesting your to hear your thoughts on longevity and aging being supported in Singapore, because I was at a conference at the National University of Singapore a couple of years ago, and Professor Andrew Meyer is one of the great longevity professors over there, and also is leading the Chi Longevity Centre there too. And it struck me quite interesting to see that level of support in Singapore around longevity and supporting healthy aging, which here in Australia, we're only really just starting to understand that, I think, and probably not so much at the government level even yet. It would be great to see that being taken on board by governments more broadly. Are you seeing that being translatable across into other cultural areas?
I do. I do. And I think longevity is really powerful. First of all, I think longevity, as we've seen it to date, has been a very male gaze. I think we see like Brian Johnson, in the US, all of these different things. But I think we're starting to see that actually women are saying, well, hold on, I still have a ton of years left in my career. I want to live healthy, live longer, and live better. What does that look like? So we know that women live longer than men, but typically 7 years in poorer health during that time of long life. So there's really a lot we can do to improve women's well-being. So I think it really does start with the trends. Again, I'm so grateful for younger generations because they're much more in tune with their health. We see alcohol consumption going down. I love to say avocados are going up, so we're seeing people eating healthier, really taking better care of themselves, and even mental health, which is a huge part of our longevity is, how we have friends and relationships around us. And I think part of that also is looking at, okay, I want to plan for the future. So what do I need to do now to be healthy at 60, even if I'm 40, 30, 20? And I think that longevity is very much front and center. And we saw the wellness trend kind of move through Singapore in particular. And now there's definitely a longevity trend, including even seeing a longevity center at National University of Singapore that's, kind of launched in the past few years. So it's exciting to see. And I think the more women again are demanding, visibility and integration of hormonal changes as part of this longevity view, I think we'll see a lot more menopause companies turning into kind of menopause and longevity, or midlife and longevity, as opposed to focusing solely on the menopause or perimenopause state, I should say.
Yeah, yeah. You've said the vision is available, accessible, and affordable healthcare for all women in Asia. Which of those three is currently the hardest to solve, do you think?
Yeah, I think where we are right now for Asia, it's availability. And I think that's because, as I mentioned, when we look at, let's say, the six largest countries in Southeast Asia, um, and the number of startups they have, we're only looking at about 110, 120 startups. So these are really phenomenal startups, but that's still very small if you think of, how many per country. And then we look at kind of the coverage, what categories they're covering. So I think there's a lot of opportunity for entrepreneurship that can actually bring more available care. I think we're seeing a lot more government partnerships starting to form with companies, which has been really positive, and a lot more corporates starting to work with startups to bring programming into their companies, which is really positive, women's health programming in particular. So I think availability, just because of literally the solutions in the market present, and being able to actually reach those, is even secondary to even just having the solutions on the ground. An example would be the complexity, again, of hormones.
Mm,
And we can test our hormones, we can check our hormones, but at the end of the day, what is the solution? And that, is harder. We know autoimmune diseases are more present in women, but we don't have the solutions for all the autoimmune diseases. So it's not necessarily available. The solutions aren't available yet. So I do see kind of, and I'm sure we'll talk about this later, but touching on like AI, deep tech, the scale and the speed of solutions is
mm,
is what I feel positively about, with AI, and hopefully seeing some of these changes come into women's health.
completely agree. What are founders in women's health getting right now that they weren't getting right 3 years ago, do you think?
Yeah, I think 2 things. I think, 1, the shift from B2C to B2B and B2B to C, absolutely necessary because we need to scale faster. So I think shifting the focus has been really important from a consumer perspective. I think when it comes to, funding, I think one thing there are 2 things that we're seeing definitely. The first one is, again, positioning ourselves as a commercial business as opposed to impact. It's shifting the narrative of women's health as a financial opportunity. I think we're doing that really well as founders. And then the other thing as founders is I think we're starting to own the value of our businesses more. And what do I mean by that? There's a real trend among our founders that they've said, you know what? I'm not pitching VCs anymore. I use an example of Anna Hertanto, who started Zora Health, a fertility company. She spoke, and she's already been a founder in the F&B space and hospitality space, and sold businesses, so she knows what she's doing. She spoke to over 100 VCs and couldn't secure funding.
Is that
So
right?
she said, "You know what?" Yes. So she said, "I'm going to go the angel route." Found over 1 million in angel money, and has since grown her business and has found a lot of success in Zora Health. And I say it again only because I want to make sure I praise her wonderful work as a startup. So when we see these types of challenges, I think more of the businesses are saying, you know what, I'm going to own my business. There's a wonderful business as well in Thailand called Ira Concept, and they create biodegradable, sustainable period products, all organic. None of the bad stuff, none of the chemicals. Really
Amazing.
great company. And she's had so many VCs, family offices, say, "Oh, we'll invest in you." And she said, "You know what? I'm happy to stay a little bit smaller, grow slower, but not have the burden of having to have the pressure of this on me." So she really is really an amazing founder because she has a very clear vision for what she wants her company to be and the impact. And with that, she's kind of owning the funding on her own. So as much as I think that does lead to slower growth, I think it leads to more sustainable growth and founders that can feel like they keep the heritage of their brand, the reasons for their brand, as well as can kind of own more of their company as they grow, which is super exciting.
Certainly is. The collective that you've created in Asia, do you think that that supportive network is really helping these women to make those sorts of business decisions that will really set them up in the long term.
Yeah, I think ecosystem connectivity is really critical, especially, we kind of move in mass, right? There's the if you want to go fast, go alone. If you want to go further, go together kind of talk. I do think what we do as FemTech Association Asia is important. I think it is laying groundwork for awareness as a kind of a primary step and actually being out in the market, bringing all of these founders together and creating opportunities to talk about their organizations. So an example of that would be, we ran a femtech forum with HSBC last year at the Women's Golf Championship. And we brought in founders and we brought in investors and we brought in academics and researchers and even just enthusiasts and corporate partners and all talked about femtech. So partnering with HSBC, we were able to do that because we're an organization of over 80 startups working together across 10 countries in Asia. And mind you, some of those countries, like Bhutan, we don't have any companies founded there yet in the femtech space, but someday we will. So in the meantime, there are advocacy partners. So I do think what FemTech Association Asia is doing is really bringing together the region and putting a voice to the market. So often I feel like when I watch um, global discussions, when there's discussion around Asia, the information is not necessarily accurate or not informed with the latest information. So I think a lot of it too is making sure that we're putting to market the thought leadership and the research that allows people to truly understand the market, not through the voice and amplification, but through the actual research that we do. So I think, yes, it's important what we're doing as an industry body. And I think uniting us all together, and when I say us, I even mean clinicians, I mean hospitals, I mean, the voice of women as consumers, kind of all of that can fall under the organization, whether it's as advocacy or investors or founders. So to answer your question, I feel really passionately about it, that community really does matter. And these ecosystems really do matter because it brings a larger point of collaboration
Mm.
for the region.
And I saw recently that you're considering expanding to like APAC with
Yeah,
your
I get
association
this
as well.
all the time. Said as a bit of a joke, but also serious. First of all, as we've talked about earlier, I love Australia. I think it is a real leader in healthcare, women's health, equity, leading in all the right ways. I mean, all of our countries have our flaws, right? But I think it's really going in the right direction when it comes to women's health. I think the women's health leaders there are very talented. And I think you have a lot of great examples of femtech founders and femtech startups making great strides and a welcome innovation ecosystem. So I think it's more about the number of people from Australia who reach out to me and ask, oh, do we have something like what you have there here? My thought on this is I'm based in Asia, so for me it's easiest to make impact where I can actually where I'm physically based. Now I would love to see more expansion of femtech into the market. I believe there is a Femtech Australia that is creating a lot of the knowledge and awareness and starting to kind of bring together the ecosystem. So it's exciting to think that maybe we can work together someday the way we work with Femtech Spain, or we have this organization called Femtech Across Borders, Azra, that basically brings together over 30 Femtech communities from around the world. And we're all, on a WhatsApp group and on emails and exchanging ideas. And, for the first time, we're running a collaborative event in Shanghai, China in June. And we have people coming over from Canada, people coming from, again, more of Western Europe. I'm flying up there from Singapore, people coming in from Japan. So it's really exciting to see that because we have this network that's growing and now we're connecting our bigger communities
Mhm.
together. Hopefully that'll create, again, more opportunities for government partnerships, corporate partnerships, being able to create more opportunities for funding for a lot of the startups that we're trying to support. So it's exciting to see this, yeah, this building and this
Yeah.
growing. And yes, it's taking longer than we'd like, of course, but good things take time, right? Good things take time.
Yeah, definitely. Yeah. And one of the things I'm seeing here in Australia as well, which is really great, is the opportunity for women founders to start to get government grants that are specifically focused on female founders. And so it's great to see those sorts of initiatives coming through. Long overdue, but great to see it happening now. And hopefully that will continue moving forward. Just a little bit more on the investor side of things. What do you think investors are still misunderstanding about the commercial potential of women's health? Because it's a huge market.
Yeah, I think I think the first thing is I think it's even more than misunderstanding, it's the awareness, right? It's that this is just not in the funding thesis. It's or there are parts. Okay, so let me give you an example. Our founders have shared with us that when they're pitching now, the first question they hear is where's AI in your solution? Which
Right.
when I hear that, I hear that's a tool driving the solution, not the, problem driving the solution, so to speak. So it's almost like a product driven solution versus a problem driven solution. So I think the first thing is that yes, AI is important. Yes, technology is important. But what's actually critical for women consumers in particular, are convenience, cost, and trust. And trust can be gained through obviously recommendations, through, trusting what we read, brand, trusting the brands that we use. But when we look at convenience and cost, I mean, women are very busy. We are holding up all of society, in my opinion. So, with that in mind, we need to make sure that we are understanding that the consumer is there and they just are being underserved. So I think for an investor who really understands that there's such a huge untapped market, it's really going to be around helping advise those founders how to get the most out of that untapped market, mainly as quickly as possible. Because I do believe our founders have very strong relationships. Retention is not an issue in femtech in Asia. It's the acquisition. How do we get more consumers? How do we bring them on board? We're asking women to talk about the most intimate parts of their lives,
Yeah.
their health. So, how do we break through stigma or break through, maybe a lack of specialists that talk about it, in the medical field or have the knowledge in the medical field. So, yeah, there's a lot to break through. But I think for investors, a lot of it is around it's a knowledge gap that we need to just build and explain, like what is femtech? What are all the possibilities? What is the actual market availability now? And that's part of what we're doing with our research. So we have a research report coming out in 2026 in June with our partner here in Singapore, Milu Research or Milu Insight. And they are helping us pull together an updated market value for Southeast Asia of what the femtech industry is actually worth. And even then, I think a lot of these numbers are underestimating based on the use. And given that, 42% of women say they'd use femtech, but they just have such a lack of understanding and awareness. That to me, like the knowledge gap, that could change everything. That so much of
Yeah.
it isn't about like better technology or being more, deep tech or AI. It's literally, are we talking to consumers, like building relationships? And that I think to me is really interesting and consistent with my whole um, professional experience of how much it really comes down to consumer relationships.
Yeah. And making this type of healthcare available through app technology as well, do you think that that might help bridge that gap or that hesitation that some women might be feeling as a result of wanting to share private information? But in actual fact, using a healthcare app might actually be the solution there, really, when you think about it, because it's quite a private way to manage your health.
Yes, and also knowing that, again, a great example of this is Ira Concept, who I spoke about earlier. The founder Room was sharing that she gets more. She's a menstrual care company. She gets more questions about sex and pregnancy because people don't know where to go
Yeah.
to get this information, and they don't necessarily want to go to their family doctor. So it's a bit tricky. So yes, I do think you're right. I do think technology is the solution as far as access goes, especially when we look at Asia, which is so massive, so many cultures, so many languages, rural communities, urban communities. I mean, what a great way to offer people connectivity, education and understanding, and even tracking, because tracking can be such an indicator, health tracking, whether it's our cortisol levels, whether it's our period, even, being able to track our symptoms. I mean, these things can all indicate what a healthcare problem may be. So, yes, I think you're exactly right. And I think that's really where the tech part of femtech comes into play is with the accessibility and, of course, affordability that we can't always drive from a rural community 3 hours to go to a specialist doctor who lives super far away when I'm far away from the big, the main hospitals, which are often in the big urban environments. So that is a cost even outside of the healthcare cost in and of itself, but actually the commute to get there, the time I'm spending away from work, all of these things cost a lot of money. And we do know that women's healthcare costs more than men's health. Women are more expensive. So, and we make less money on the dollar. Things aren't in our favor here. So technology, yes, can be a great asset for us.
And do you think that some of those points that you've made there are quite strong and quite valid from a government perspective when you think about how this can support government funding and cutting back on healthcare and helping to support women to manage their health and longevity moving forward? How do you think that that is actually going to support governments and support government budgets moving forward and help refine their policies a little bit more to factor this in moving forward?
That's such an interesting question. And I think the first thing I'll comment on is preventative health.
Yeah.
So the reality is, the better we take care of people, the less expensive it is to actually have to care for them in the hospital networks. So, what can we do outside of the hospital medical networks to keep women healthy? And a lot of that can come through FemTech. Again, making sure that we're tracking early identification of issues, helping women better understand their bodies so they can catch things earlier. When it comes to actual, healthcare, we look at a lot of national healthcare systems, and there's so much pressure on these hospitals right now. There's so much pressure on these doctors, these nurses, these medical specialists. I mean, honestly, I really feel for them. There's so much pressure on them. So, what can we do to make their lives easier, to lighten the workload, and even to cut costs on a hospital level by using technology and outsourcing? Maybe it's the care after, helping people get out of the hospital faster because they actually have telehealth or hybrid clinics that femtech founders are starting, like Kindred Health in the Philippines. They're creating a whole network across the country of hybrid women's health specific clinics. Fantastic. That gives us a place to go that is specialized in women's health. And also they do telehealth and they support with, pharmaceutical. They're really a holistic care center for women. And that takes a lot of the burden off that public healthcare system and can work through private. So I think it's really, when we talk about government involvement, it's preventative health, and it's thinking about how these femtech companies can integrate rather than compete. How can they integrate to support where you don't need to be in the hospital for the care?
Because nobody wants to stay in hospital for any longer than what they have to, right? And I think that
I mean, for
people
so many.
actually heal better when they're at home in their own environment. They're getting the right nutrition because even hospital food isn't really set up for for healing and recovery.
Absolutely. And I think this is where we're seeing a trend in the market here in Southeast Asia in particular, and seeing it in other places like Hong Kong as well, where there is more kind of public private sector partnership happening. We see a lot of academic institutions partnering with commercial to actually create things like GRIP, the Graduate Research Innovation Program here in Singapore, that is actually taking PhD researchers or robotic specialists or diagnostic specialists and actually creating like a partnership and mentorship to commercialize their ideas. So it doesn't get stuck as a really great piece of research or a really great medical device, but doesn't scale. So they actually are putting kind of these brilliant researchers and PhDs together with commercial experts to say, how can we get this to market? And I think that that's really powerful when we see these types of partnerships happening.
And that's a great segue into the fact that your community has highlighted funding, regional scale, and customer acquisition as top priorities for femtech founders moving into 2026, right? So, why are these three proving so challenging, and what is the solution moving forward? Because we want this tech to be out there. We want to be able to support these female founders to be successful in their businesses. How do we prevent this from happening?
Yeah. And I think this is, again, you make another great point from you is really looking at ecosystem wide. So I think we need to make sure that we're really, strengthening the ecosystem that's focusing not even just on women's health, because I do believe women's financial health is part of women's health.
Oh, yeah.
So I think I look at women's health quite broadly at this point, I'd say. So I think the first thing is to make sure we're kind of strengthening the ecosystems and supporting the ecosystems like FemTech Association Asia, like Vilgro Philippines, based in the Philippines and India as well, trying to support women entrepreneurs, a lot of which work in the AI for health space. So I think it's really helping on the fundamental level, ecosystems succeed with incubators, accelerators, like help support those who are, pushing this industry forward. I think secondly, we need to look at, we have a lot of research, but there's not a lot of governance around it, and it's quite fragmented. So the second thing would be, how do we as an entire industry, an entire ecosystem, support kind of stronger research and more digestible and accessible research, and also research that is conducted on people in Asia as opposed to using Western data and applying that here. We need to make sure that we're looking at our communities here. When we talk about increased awareness, we need, the governments to be involved with public service, which we've really seen. We've seen some really great work by, in Vietnam with free HPV shot. Forgive me, the cervical cancer shot. I can't remember the brand name of it right now, but you know what I'm talking about, the
Yeah.
vaccination against cervical cancer.
Yeah.
So we see some really that's free. We see, free mammograms, which is really great to see in a lot of countries. So the government is getting involved and starting to, again, look at that preventative care. We see a lot of trying to help women through the investor lens. So getting more women up to speed on investing and really helping diversify who's in the room. So it's not just, again, all men being supported, it's having more women in the conversation. And that comes through angel investment groups to help educate women on investing, or, of course, making sure that our hiring processes and protocols are making sure they're inclusive and not cutting women out, whether it's from, the maternity tax where women take off work and try to come back to work, and it's just incredibly difficult. So there are all these layers of complexity, but I think it really is around having everyone feel like they are accountable for women's health and women in general on some level.
Mm. You helped host FemTech Connector Asia and release research on the Southeast Asia FemTech landscape. What did that work reveal that surprised you?
Yeah, so that was one of FemTech Association Asia's first. So we actually hosted the first ever FemTech industry event for founders, investors, government agencies, and, even enthusiasts came, which was quite fun. People who were just really passionate about the space and consumers. So we launched FemTech Connect Asia in partnership with Cigna, HSBC. Tatler was one of our supporters. Nespresso served our coffee, really fantastic. So we had a really wide range of partners. Singapore Global Network, which is part of EDB here. So we had a lot of people very involved. Now, first of all, I think the first thing that I found really, I'll talk about maybe the really exciting parts of that first. We were able to work through research that had never been done before. So again, FemTech Association Asia, our organization, created really the first ever consumer research in partnership with Milu Insight on women's health. So I think the first thing that probably surprised me was that only 25% of women in Southeast Asia were familiar with the term femtech, and this is in 2024, and really were familiar with the women's health industry, like that there was actually an industry that was considering their health in particular. I found that really, really interesting. I think the second thing I found interesting was the engagement. As I mentioned, the sponsors. The reason I was rattling through some of the sponsors, it's insurers, coffee companies, banks. It's the interest is so diverse
Yeah.
in what we're doing. And I think it's figuring out how everyone fits into that ecosystem. And a lot of people and companies ask because they're like, I don't know how to partner, but I want to partner. I don't know how to support, but I want to support. So I'd say a blind spot for FemTech Association Asia is, how can we be better, or something, maybe not a blind spot, something we can do better is, how can we better create plug and play models that the broader ecosystem, from a wonderful Biohacker podcast, can say, how can I get involved? So how do we're not creating that clear path for you to get involved, right? Or how do I go to another insurer and say, this is how you can get involved? So I want to create more plug and play models that are really transparent and very clear for all different individuals or companies that want to get involved in women's health. That taught me that there's a big gap there, that we need to help fill that through templated partnerships, basically.
Lindsay, AI is increasingly entering women's health. What excites you most and what worries you the most, especially around bias, privacy, and
it's, as I think we were talking, Justin Trudeau said at the CNBC event yesterday, it's happening. It's not good. You can quit talking about whether it's good or bad. It's happening. So with that in mind, I look to it and I say, okay, I'm going to start with the things that worry me. I always love the bad news first. The things that worry me, first of all, are representation of in who's building it. So 12% of researchers, 22% of employees at technical employees, excuse me, technical employees at major machine learning companies are women. So underrepresented as far as who's actually building the AI solutions. Second thing that worries me is what you said around bias or underrepresentation. We look at who's actually being included in AI and in the data sets. Are we looking at menopausal women, pregnant women, non cisgender? Are we looking at ethnic minorities? Are we being inclusive in how we're setting up our AI? So, those are some of the things I think about that bring concern. When I think about things that excite me, category wise, we've seen the most positive progress and use of AI with oncology, fertility, and pregnancy. So, three very important categories. What could some of that look like? It could look at improved diagnosis for women, which I'm really excited about. More cost effective care for both women and for the providers, which again, mutually beneficial. And then, of course, looking at personalized care. Women's healthcare journeys, as we know, are so personal and so different. What we all go through, our hormones, our biology, how everything's working, very different. So I do believe that AI can start maybe finding some of those trends and doing some comparison to help us actually better understand our bodies when we look at kind of a broader data set. So those are some of the positives and then the things I'm concerned about as well.
Mm. I wonder whether there is going to be some resistance because people are concerned about what will happen with their data, how AI may influence that, whether negatively or positively. Your thoughts on that?
Yeah, so let me just talk about speaking with the founders about this because I've spoken with several founders. So keep in mind it's a small group, but we don't have that big concern around data yet. I know in the US in particular, it's very concerning, especially around, tracking and pregnancy and abortion and some of these hotter topics in politics. However, in Asia, we just haven't seen that level of concern. Obviously, people say, I want my data private. That's the concern. But I don't think we've seen that association with AI as strongly around data privacy and confidentiality, though we obviously know that's a part of AI. So I think that's less of a primary consideration still, though on the list, of course.
Mm. What would you say to people that think that they don't trust AI or they don't trust what AI would prescribe or recommend as opposed to a human medical practitioner?
Yeah, I think much like I consider all technology, including femtech technology, they're indicators. They're great resources to use for tracking, for learning, for considering. But ultimately, we should always still go to our medical providers and make sure that whatever we're seeing online can be validated and verified. I do understand this is really difficult, especially with the lack of specialists in women's health that we see in certain countries, or even the patient doctor ratio in certain countries. There are shortages of doctors in some countries, so I understand that sometimes technology can be that first port of call. I think that's the whole point of femtech is, we think of it as it's something to learn about our bodies. It's something to track. It's something to, spot trends. It's something to even just have to hand. So when we see our doctor, we have better questions to ask because we're more empowered and we have better ideas. So I think for those who are scared of AI, rightly so, it could be something that we should all be very aware of and take with caution. But I think also we need to think about how do we bring everyone on a positive journey that everyone can benefit from the use of AI. And a lot of that won't just be down to, regulating it harshly, but actually educating people on how it works. As you can tell, I'm a really big fan of education, awareness, and community building because I think those are really core. And all of those, as you rightly say, come down to that human to human interaction.
Yeah. If you could change one thing tomorrow for women navigating healthcare systems, what would create the biggest ripple effect, do you think?
That's a tough one. That's a big question. I feel like I only get one. The first thing that comes to mind really is around funding allocation. So I don't even necessarily mean, oh, fund the startups. I mean, how much money are we putting into women's health? A great example is KKH, the hospital here in Singapore for women and children. really does a phenomenal job. I mean, they're focused on women's health. They just launched a mental health well-being side to their organization, to the hospitals. So they're really trying to create a holistic care center for women. So I think a big part of it is where are we actually putting our funds, whether they're private funds, public funds, personal funds as an investor? How are we allocating our funds? So that would be the biggest ripple effect, I think, is making sure that we have the funding of our research, our, our hospitals, our specialists, the next generation of doctors focusing on women's health. I think all these things are really important.
For founders, clinicians, and advocates listening to this who want to help to close the women's health gap, where do you think they should start?
I think a lot of it is, I was thinking about this earlier, and I think how can everyone contribute? I think the first thing is to get out of our vacuums. And by that, I mean, often with women's health and femtech, I even look at, my algorithm on LinkedIn, and it's like the world is only people who work in women's health. Clearly not the case. So I think a lot of it is around making sure that we are, interacting with people from outside of our industry or outside of our interests to really learn about how they approach their businesses, how they approach their consumers. What can we learn from other industries that we can apply? An example of this would be I look to the gaming industry a lot. When we're talking about technology and getting women involved and helping educate and looking at, from younger ages, moving forward, how do we gamify healthcare to make it something that is actually fun to engage with instead of burdensome and I have to type out what happened? So I think there are all these things we can learn. So a big part, I think, of getting involved in the ecosystem is to really, first of all, educate ourselves on women's health and educate ourselves on our own health. Because if we ourselves aren't healthy, how can we possibly take care of other people? But secondly, it's really making sure that we're not looking at women's health and femtech as its own industry in this corner of the ecosystem all alone. It's no, we are directly connected to climate impact. You know, Climate changes impact women and children more than anyone else. So, sustainability, okay? Sustainability and how the world is going to be in the future, that matters to women. Agritech, when we're talking about fintech and lack of representation of women in the space, like it's all very interconnected. So I think we need to make sure we're not just talking about women's health on its own, but actually building education and awareness on a broader scope.
Mm, completely agree. We're starting to see more women coming through into this space and into the femtech space, which is great to see. I even know a young girl who's in high school who's working on an app that she's
Amazing.
launched, and it's so amazing to see what she's done. What's one piece of advice that you would give to a female founder if they were just kicking off their business?
Yeah. I mean, we are 83% women founders here in Southeast Asia in the femtech space. So certainly very, we have wonderful male founders as well. And we're so glad they're a part of our movement, the women's health movement. So knowing that I spend a lot of time talking with and thinking about women entrepreneurs, I think the first thing I'd say is like take action. I think so often we're like, oh, well, it's not big enough, or oh, I haven't done enough work on it yet. A lot of times 85% is enough to go. I don't think we always have to wait till 100%. So I think it's really important that as women, we kind of own it and we move forward with it and have the confidence to know that we can fail and come back from that. We can try things, take risks. Like this is all part to me of being a founder and entrepreneurship, is to not let external forces dictate how we take our businesses forward. If we truly have done the market research, product market fit, market entry strategy, and we really know our problem and we've studied our problem and we know that we have the solution. I think the idea is don't stand still waiting for, no one's going to come save us. As I always say, we need to kind of move forward on our own. We need to do the pitches. Don't let the failure overcome us. Yeah, someone's going to say, no, I don't want to invest in your company. Fine, next. It's all about kind of continuing to move forward. And so I really encourage founders, especially women founders, to keep pushing forward. And if they have conviction in their idea and have done the research and the work, there's no reason they shouldn't just keep pushing forward and, be ready to pivot and be willing to fail and take the risks. So those are some of the things I think of: movement mainly, and taking action.
Lindsay, it's been great chatting with you today. It's been an absolutely fascinating conversation and really interesting to see how this femtech movement is growing in the Asia region. If people are wanting to connect with you or wanting to learn more, what's the best way for them to reach out to you?
Well, first of all, thank you so much for having me. I love the Biohacker podcast. It's been so fun chatting with you and actually getting to listen to a lot more. I'm learning from you, which is making me happy. I love learning and about women's health. You can learn from all around you. So the best way to get in touch is on LinkedIn, of course, which is Lindsay Davis, and obviously founder of FemTech Association Asia. We have our website, femtechassociation.com. And of course, our LinkedIn as well for the organization. So we always welcome people to follow us or to join our organization. And of course, if anyone comes to Asia, we always love to welcome people here in person. So let us know.
Fabulous. And I will pop all of those details into the show notes. Lindsay, thanks again. It's been great chatting.
Thanks, Ezra. I appreciate it.
Well, that's a wrap for today's podcast. Thank you for tuning in. And if you'd like to learn more about biohacking, go ahead and sign up on my website at www.biohack-her.com to get a free copy of my 5 top biohacks to get you kick-started. While you're there, you can also check out my blog page for more tips on biohacking. If you'd like to subscribe to this podcast, you can do so on Apple, Spotify, and Google Play. Let us know if there's anyone you'd like us to talk to in particular, and we'll endeavour to get them on the podcast. Until next time, remember to live well longer.